Good morning and welcome to Living Local 15. I'm Jessica Williams. Thank you for joining me today. We have a great informative show for you, so let's get started. First up, I visit Benchmark Physical Therapy and learn all about their free injury and fall risk screening, plus their specialty pelvic support offered like no other. Then we are joined by real estate expert Andrew Jones, and we discuss the interesting topic of buying a home on the market versus buying it from scratch as a first-time home buyer. Are you ready? Let's get started.
Fashion, food, and fun. You're watching Living Local 15 with your host, Jessica Williams.
This segment sponsored by Benchmark Physical Therapy. I am outside of Benchmark Physical Therapy, which focuses on pain reduction and improving the quality of your life. I'm going to go in, learn more, speak to their board-certified professionals, and also try out their demo. Let's do it. Joining me now is their clinic director, Dr. Claire Brecky. Hi, doctor.
Hi.
How are you?
I'm great. How are you?
Doing well, thank you. I'm excited to be here and to learn all about your physical therapy practice. And so give us a rundown about Benchmark.
So Benchmark is an outpatient physical therapy provider. We serve our community here in Columbia City as well as in New Haven. We specialize in orthopedics, and actually pelvic health is one of our niche specialties in both of our offices. That is very underserved as a population.
Right, it is. And you bring a special skill set because of your actual medical specialty. So tell me about that.
Yes, so I was board certified in orthopedics back in 2019. So it gives me a really leg up to help treat patients that have complex injuries or complex surgical recovery processes, and it just allows me to better serve each patient.
Yeah. And tell me about some of the patients that you see here and some of the issues that they may have.
Yep, so we see anything from post-surgical. We see chronic pain, a lot of chronic pain. We see dysfunctions of bowel and bladder functions with our pelvic health. We even see pediatrics, so kids that have developmental delays. We try to serve our community in a greater way by seeing all patients. And we even do balance screens and work with fall risk patients that have Parkinson's, musculoskeletal issues, and even MS.
Wow. So. And compared to other physical therapy practices, what really sets you all apart?
I think the culture, is the big thing. Our patients love coming here and they feel a part of our family. We know every single one by name, all the clinicians do, even our front office. And we just strive to fix the whole person or help the whole person. So not just the physical, but they might give us a little bit more deeper into their, home life or their emotional situation. And we are always very empathetic in hearing that, which I think brings a better healing to the group and the patients.
Yeah, that's so great. And you also offer a service to the community so they can really come in and see if they are a right fit. So what about your free screenings?
Yes, so we right now through the month of October into the end of November are offering free fall screenings and injury risk prevention screenings with our Move to Live campaign.
Okay.
And it's important to know too that most people are at fall risk, not just our senior citizens. So anybody with, like I said, those musculoskeletal components that are like arthritis or like poor mechanics following a surgery, or even our neuromuscular people such as Parkinson's or MS are also at fall risk. So it's not just our geriatric population that we can serve with these screens. We can serve the entire population. Anybody 18 or over can come and get a screen.
And so do you really focus on the rehabilitation after the fall or preventative measures to kind of help before it happens?
Research shows that, preventing them is the best source of medicine. Coming in for those regular screens allows us to, suggest things based on what we find, removing fall risk options such as rugs in a household or in a hallway, making sure you have good lighting in your hallway and bathroom, because at night we like to always use the restroom, right? And then just making sure we follow up with our primary cares. Oftentimes people kind of let that go by the wayside. So we're another kind of door to knock on of, hey, have you had your annual appointment to do a medication check? Because a lot of times that can cause some fall risk issues.
And everyone needs to be held accountable.
Of course,
so that's great. Well, doctor, I would love to see the demo take place of your free screening.
Absolutely.
Shall we do it?
Yes, let's do it.
All right, let's do it. All right, Dr. Claire, we're going to do our free screening demo. And who is this?
This is Nancy, my mother-in-law.
Hello, Nancy.
Hello, nice to meet you.
You too.
Nancy is here. She was a previous patient of mine. She let me be her therapist, and she had a bilateral hip replacement. So she had a hip replacement before we met, and then she actually had a hip replacement only about 5 months before my husband and I got married. And her goal was to be able to dance on the dance floor pain-free.
Oh, it's your wedding.
Yes.
Okay,
yes.
did you hit that goal?
Yes, I did.
You got your boogie moves in?
We got to cut the rug.
I love it. So tell me, what was your experience like going through physical therapy?
It was life-changing. You know, like I said, I wanted to be able to dance because I walked with a cane. It was horrible, just moving. And as my son said after my surgery, you're smiling for the first time, Mom.
Oh.
And the physical therapy really helped to move me along and correct some really bad habits I picked up.
Right. That's great. And Dr. Claire, can you kind of share about that journey in the sense of like when someone goes through that recovery status or their rehabilitation, what's that process like for them?
A lot of it is education from the front end, you know, reteaching those bad habits like Nancy mentioned, but also, you know, being an educator to them as far as the process. You know, a lot of people I think are undersold sometimes of what that actual surgery entails. So educating on the surgery, but then also educating on like the precautions with that surgery and how they can expect their milestones to be hit in a timely manner. So education, I would say, is the biggest part that we do in the post-operative recovery.
Yes, in that area of having hip replacement, you also really focus on the pelvic area, and that's a specialty that not many people do, right?
Right. A lot of times pressure management is a big problem with women and even men actually. And so being a pelvic therapist, and we focus on pelvic therapy here, we try to fix the entire problem, right? So arthritic hips, yes, that's probably an issue, but poor core control leads to back pain, which then might have led to the hip dysfunction to begin with. And so, you know, we start as early as people who are, you know, prenatal care before they have their children, and postpartum care as well. We don't wait till later in life. The sooner we can get people educated on their body mechanics, educated on how to move in space correctly, the better for them long term.
I love that really, because as I think about it, women, when they get pregnant, there's so many things that they prepare for, but not how the baby is going to impact their bones and their body below in that way. So I love that you start the care at the beginning and you follow it through to the end. That's really important to know.
Yes, yes.
Yes, okay, so let's see this demo. How do we get started?
So with our Move to Live campaign, we're going to be checking for strength, we're going to check for balance, and we're also going to check for just overall gait mechanics. So the first test we're going to do is for gait mechanics, so it's called the tug test, timed up and go. So Nancy, I'm going to have you sit in the chair for me, please. I'm going to grab my timer because this is a timed test. When I tell you to go, you're going to stand up without using your hands. You're going to walk down around the cone, and then you're going to come back and sit down. The test will be done once you sit. Key is to be effective with your speed, but also walking safely. Okay? Ready? And go. And also oftentimes we like to follow our patients because you never know what will happen when we're doing a fall screen.
Okay.
So we'll always be following the patients. Good, and sit. 12 seconds. That would be in the normative value that we have, that would be a low fall risk as of right now.
Okay, wonderful.
All right, and then the next test we're going to do is called a 30-second sit to stand test. This is to work on the functional strength. It's amazing how many people forget that at one time they were able to stand up and down without using their hands for that support. So this test actually highlights the lower leg strength.
Okay.
So Nancy, what we're going to do is I'm going to actually use my watch here. We're going to stand up, you're going to cross your arms across your chest. We're going to stand all the way up and all the way back down for 30 seconds. But you have to go all the way up and all the way down. No plopping. All right, and go. 1. 3. You got one more in you. 9. Good. So
Wow.
for this one, Jessica, we're looking for about 10 times within that 30 seconds is a normative range. Anything below that will probably show us that there is some functional deficits and weaknesses that we can definitely work on to help prevent falls.
Wow, and it's a secret workout too. Building that core. And this test is for all ages, right?
All ages 18 and up can come and get this screen done.
All right, well, let me take a seat, Nancy, and give this one a try because I don't know if I can do it. You're kind of good at it. Okay.
All right.
So no arms.
No arms. You're going
All
to
right.
cross your arms across your chest.
Like this.
And the key with this one is control too.
Okay.
We don't want to kind of just jerk ourselves up and then plop back down, right? We can use our momentum, but we don't want that to be the end all be all.
Okay, use the core.
Use that core,
Okay.
engage that core. We always like to say bring the belly button up and in. All right. Are you ready, Jessica?
Yes.
And go. 1.
Feel it in my hamstrings.
Good. Should also feel it in those glutes. Yes. They are functional and important for our bodies, for back pain and for falls and for any kind of
keep 'em
gait
tight,
disturbances.
okay.
Keep them tight and done. You got 8.
Woo-hoo.
Congratulations.
That's not good. When it's supposed to be 10.
That's our goal. But
okay, gotta
that
build
means
up
we
to
have
it.
room to grow, which
Okay.
is always important. That's what we
Awesome.
want. Yes. And then we have one more screen that we can do, which is for balance. It's called the Y balance. So I'm going to set it up, but when we have people come in, we'll actually have a measuring tape out because we have to know the distance that the person can, what we call excurge, so going as far forward as possible. So Nancy, I'll just have you step on the line for right now. Okay, and let's do your left leg because that seems to be your stronger leg. And what you're going to do is you're going to stand on your left leg and reach your right foot as far forward and tap as you can. Good, and then bring it back. Then you're going to come out to the side with that right foot and tap. Good, and back. And then you're going to kind of reach back and to the right a little bit. So you're almost kind of crossing, or to the left, excuse me, crossing your body. There you go. Good. And we would then measure that, and that also gives us normative data to kind of assess where you fall in that fall risk category.
Oh, okay. Let me try this one too. Let me try this one.
All right, so you're going to stand on your right leg,
Stand on
and
my
you're
right
going to
one,
reach
okay.
as far forward with the left, and you're just tapping. We don't want to transfer the weight. You're just going to tap forward. Good. And then bring it back, and then out to the side. Good. And then back, and then now you're going to kind of come back and behind towards me. Yep, there you go. And we would measure that and then assess where your fall risk
okay.
is.
So Dr. Claire, share with me about your Move to Live program.
Yeah, so it's a new program that we're kicking off for the month of October all the way through the end of November. And we're really wanting to provide the community with tools to utilize to see if they're at a fall risk and prevent that. They can go to our website at movetoliveusa.com and sign up there through a portal. And they'll be able to sign up anywhere between 9 and 4 p.m. And then our offices will call. And the offices they can use is our New Haven location, which is Dreyer Physical Therapy, or here in Columbia City, which is Benchmark Physical Therapy.
Okay, wonderful. And during that appointment, will they do the free screening and all of that?
Yes, they'll do the free screening, and we even have a tool called the Sparta Balance tool, which actually gives data points in the entire country, and it's specific to your age and your gender of where you fall in your fall category.
Okay, so how does that work?
It's a force plate that you stand on, and you do what's called a progressive balance screen. And so in order to, you do all the steps, and it kind of scores you. And so we as clinicians know the ranges we need to get to and what would be what we call a significant change. And so you would come back again after doing therapy or maybe a home program, and then you could get retested and seeing if your score improves.
Oh, that's really nice.
Yeah.
Okay, awesome. Well, if people are interested in learning more about your practice, they want to book a screening or anything else, where should they go?
They can go to our website at Benchmark Physical Therapy. They can also go to our Dreyer Physical Therapy location, but they can also give us a call. We love to talk and answer any questions. So they can always find us on Google is a great place to find the address and the phone number, so they can find us there and always call with any questions.
All right, wonderful. Thank you so much,
Thank
Dr.
you.
Claire. It was a pleasure to meet you.
It's so nice to meet you as well.
Thank you. And if you would like more information about Benchmark Physical Therapy, we'll have their website listed below, and we'll be right back. This segment sponsored by Benchmark Physical Therapy.
Follow us on social media at Living Local 15.
We've talked about being a first-time home buyer, but what if you are buying from scratch, meaning you are building a home? Well, guess what? Today we have a real estate expert to share more, Andrew Jones with Liberty Group Realty. Good morning, Andrew.
Good morning, Jessica.
Welcome.
Thank you.
Yes. Okay, so this is an interesting topic, and this is something that you actually have specialty in because you've been in this industry for over a decade and have worked at all facets to bring us here. So share a little bit about your journey to become a real estate agent.
Absolutely. So my inception of my journey starts 2010 when the idea was presented to myself to get my license. Long story short, I get my license in 2012. Then end up graduating, working for a builder as a new sales rep and maintaining my license. Then we get licensed as a loan officer and then to practicing general real estate as a realtor. A lot of that inception and just the why is I enjoy service and I believe service is purpose.
Yes.
So that is how I serve.
Okay, awesome. And I love that because it feels like all of those different levels of experience really culminates to the point of doing your best job as a real estate agent, but particularly helping first-time home buyers with building from scratch. And that's not something really talked about much because you're used to, okay, having an established home and a seller selling you their home. But what if you buy from scratch? Who is the seller?
Great question. So the seller, if you're building from scratch, is actually the builder. Okay. They're going to act as the seller. A lot of people don't know you can work with a builder while still having a realtor representation. So you can go in there, have someone as a realtor looking out for you. The builder is as well. But you can start that process from scratch, picking out a floor plan, personalizing it, whatever caters to your needs and wants. But then you can also buy a spec home, which is a home that's built off of speculation that this is what somebody would like.
Okay.
So, yeah.
Okay, that's interesting. So I'm sure people are thinking like, oh my goodness, if it's my first time buying a home, wouldn't that be challenging to actually get it from scratch? Like that sounds like a lot of work. So what do you think are maybe a couple of misconceptions people encounter with this thought process?
Absolutely. So for one, like we just said, that you can have a realtor. I think that's going to alleviate a lot of the stress, especially if it's a realtor that is experienced in new construction and just that process. So that would be, I guess, myth one that we can debunk is that you can't have a realtor. Okay. Myth two is that new construction, you got to put 20% down. That's a common in general with home buying. But yes, just like buying existing, you can do the minimum. The minimum down payment depending on your loan type. And then the third would probably be that is possible. Anybody can, if you're a first time buyer, getting your second home, whatever the case may be, you can go with a builder and build from scratch or just buy something that they've already built and alleviate the time.
So that gives a couple of different options now. I'm thinking about it and I'm listening. So someone can buy from a seller, but if you do want a home, it could be a home that you build from scratch, that you're choosing all the fixtures and all of the options, or like you said, a spec home. A spec home, just to be clear, is something that is brand new. No one's lived there, but you don't get to make the customizable decisions. Is that correct?
That is correct.
Okay.
Typically with a spec, it's already built or it's in the process of getting built, and a lot of people, there we go, that might be a better one. If it's a spec home but it's not finished, that they can come in and, they're like, hey, well, you haven't put the countertops in yet, can I change this? All that stuff is usually already ordered and on its way, so a lot of builders might be reluctant to make those changes because, that's added cost and it's already been bought.
Right.
So, but yes, you might be able to make some small ones depending on what stage you come in there, but overall, yes, the house is built and you pretty much are getting what they've already selected.
What are some of the pros and cons between the two? New home versus established home.
Okay. So we'll start with the pros. We'll say pros of new home. It's brand new.
Yes.
So
brand new.
So no one's lived there. You're not adopting or inheriting someone else's issues that they had with that house. So brand new, it comes with a warranty in most cases, I would say. So you have that security, if you will. And as well, it retains its value typically better because obviously it's brand new. So pros would be that. Cons, it can be a time situation depending on what your schedule is.
Yeah.
Typically, I mean, depending on like material, chain lines and stuff like that, it could take anywhere from 8 to 12 months, maybe longer if you're doing like a customized. So on average, you gotta, you're gonna have to take that in consideration. Maybe you need a house in the next 2 months because your lease is expiring.
Right.
But that's where a spec home might be more advantageous because it's already built or it'll be done within the next 2 months. So that could be a pro or con. Another con, the entry barrier, I would say, price point is typically higher because it's brand new.
Okay.
So that could be a hindrance for some people depending on what their budget is. It might not seem as affordable in that season. So yeah, that would be, I would say, the pros and cons. But a good thing, I think, in this market right now as a pro, a lot of builders are offering incentives. Because they have inventory that they need to they need to move, if you will, and so they're offering incentives to incentivize buyers to, hey, come over here, we'll give you this much in upgrades and allowance. We might buy your rate down a little bit. We might even take some off the price. So it just depends on what the builder's offering. So definitely shop around.
Okay.
Yeah.
Okay, awesome. Well, thank you so much for
you.
your advice today, Andrew. We appreciate it.
Thank you so much, Jessica.
Yes. And whether you're looking for your dream home or just a right now home, there are so many options available on the market, but you need a good real estate agent to help navigate you through it all. So if you would like more information about Liberty Group Realty, we'll have their website listed below, and we'll be right back.
Living Local 15, proudly driven by the Kelly Automotive Group.
Well, that's our show for today. Thank you so much for tuning in. And remember, you can always rewatch segments or full episodes of Living Local 15 by going to WANE.com and downloading the WANE app. And remember, it's never too late to live your best life. So start living it today. And I look forward to seeing you here tomorrow. Bye-bye.
Content segments during today's Living Local 15 were paid for by these sponsors.